Welcome back to the Federal Executive Forum on Federal News Network. We're talking about healthcare. I'm going to start getting into specific programs that we'd like to highlight. Dr. Evans, I'm going to start with you over at VHA. Give us an example of a specific program you'd like to highlight for the listening audience.
Sure, Luke. Well, I just wanted to come back briefly to what I mentioned in the first segment about telehealth. And I wanted to just provide one sort of adjustment to the data that we were doing about 2,000 video visits per day before the pandemic, which was quite a lot. We were one of the leaders in delivering telehealth to the home. And that increased to more than 30 to 35,000 per day now. And just to give you a sense to follow up on that, that's over a 1,200% increase in FY20 compared to FY 2019. So from before the pandemic to beyond. And what we're seeing in VHA is that desire for connections where there's a seamless intersection between both virtually delivered care, whether that be through secure email, whether it be through telehealth, or what the virtual capabilities, connected capabilities, are increasingly part of care right alongside face-to-face care. Both of them matter, and it's that sort of seamless combination of both that's really appealing to those who are receiving care from VA. On the topic of a specific project, to sort of take that the next step, right? Relationships are super important in healthcare, and telehealth technologies let us connect veterans and their caregivers with the staff members, VA staff who are there to care for them. But without the data to support clinical care delivery, we're missing something. And I think one of the things that really excites me, and this follows some of Ryan's comments in the first segment, is the volume of data interchange that's occurring across the health sector that continues to increase. And the real opportunity, as we increasingly are leveraging some of the standards that ONC is helping to promulgate across the industry, the potential is really significant. But I'll just highlight our Joint Health Information Exchange. This is a shared effort between the Department of Defense and the VA. And the DoD and the VA, as a shared Joint Health Information Exchange, are sharing data with more than 65% of private sector hospitals. And by the end of 2022, we're going to also connect to the Care Quality Network, which will increase our sharing to more than 90% of private sector hospitals. To give you a sense of what that means from a volume perspective, VA and DoD are delivering nearly 5 million documents to community partners. That means private sector health providers are able to see records of the care that we're delivering in the VA and DoD to support the care of the veteran or service member who's in front of them. And we're retrieving more than 40 million documents per month for VA and DoD providers to have access to that information that's occurring in the private sector healthcare system for the delivery of care to the patients sitting in front of us in the federal healthcare system. So super exciting to me. And the opportunity there, and I'm sure Ryan probably has some comments on this further, as we implement FHIR, as we continue to push this data into GHGs, we start to meaningfully insert that data into providers' workflows and into the hands of patients. I think there's a real tremendous opportunity in front of us over the next couple of years.
Absolutely. And we're going to hold on Brian for a minute. I'm going to jump over to Jonathan because I thought about the scale of that customer experience. And I think about things like IoT devices and some of the things that are going to come. Maybe that's your answer to your futures question. But give us an example, Jonathan, of some of the stuff that you are doing right now that you'd like to highlight in sort of the healthcare segment.
Sure. It's a hard question to answer because ServiceNow is doing important work at agencies all across HHS, doing important work at the VA. At CMS, for example, we've built an employee portal where we can consolidate access to services. And at the VA, IT service management alone has helped make the Office of Information and Technology a lot more efficient, saved millions of dollars in the way that they do their efforts. We've helped them save lots of money through software asset management, and reduce clinician time just through simple things like self-service for PIV exemptions and password resets. But you mentioned in the beginning, a lot of agencies used ServiceNow as part of their COVID response.
Exactly.
And that was a game changer in so many places, because very quickly we were able to create emergency response capabilities, then vaccine management capabilities, and vaccine status reporting. I think over 300,000 federal employees' vaccination statuses were captured in ServiceNow during a very short period of time, when that was a really critical action for the administration. But when COVID hit originally, and we're trying to figure out why some people became more sick than others, agencies and offices at the National Institutes of Health took on a lot of these challenges. And we worked with the National Cancer Institute in that case to build a portal where patients and doctors could securely share samples of COVID results and related data, patient data. So researchers could start to think about genetic factors that may increase one's likelihood for severe COVID. And, we used the ServiceNow platform to quickly deploy that kind of capability. And then in a very agile manner, continue to update it and modify it so we could capture information related to changes that were occurring, like once the vaccines were introduced, and how would that impact severe COVID and other things. So that's just one of many examples where the ServiceNow platform was deployed quickly and securely, and positioned in a way where both doctors and patients and researchers could collaborate. So it's very customer focused, but also employee focused set of workflows and capabilities to streamline a really important operation at a time where you don't have a lot of time to design and redesign and deploy and redeploy and think through every aspect of things. You have to go really fast, and we were able to go really fast with the National Cancer Institute in this case, and it made a big difference.
Really fast and very secure, and all the sort of the platform environment comes to bear. You're able to stack these applications on top of it and develop them very quickly. It's fantastic what you all have been able to do with that platform. All right, Ryan, we're coming over to you to talk about whatever you'd like to talk about as far as highlighting a program.
Sure. So
referenced several times here.
So I thought you're skipping me because the data integrity is not the most sexy conversation topic to get into, but I'll just but just a few points to add. So we have really a prioritization on that data quality and on the integrity of the data. And we've been working in earnest on that for several years through our US core data for interoperability, which we believe has been one of our more successful programs to date, just in the sense that it's established that minimum data set for the healthcare delivery system. And while it is not comprehensive by design, because we want to make sure that, again, the playing field is level and it makes sense from a provider burden perspective. So if you're in the context of a telehealth visit, you might not have time to add all of the different features and the narrative text and all the different components that a lot of people are really interested in across the continuum. But we don't want to, enforce anything and require anything that doesn't make sense for the majority of the system. So that is really sets the standard for the data elements and the corresponding vocabulary standards. It's agnostic to format, which is really helpful. And it is updated on an annual basis through a transparent consensus based, in the sense that we get hundreds and hundreds of submissions and comments from all across the country. So not just our federal partners, but nonprofit organizations and advocacy groups and provider organizations. And that has been not only helped create the foundation so that you can move quickly. So we talked about speed and the need to move quickly and the need to be able to move the data as fast as possible, but you can't do that without first building a strong foundation. So I used to be in the commercial building industry, and I had colleagues who had been around for decades who built, the largest skyscrapers in the world, and they always said, you can't build a skyscraper on a pile of sand. It's cliche, but I think it holds true in healthcare, and I think about it all the time when I am trying to encourage people to care about the semantics of a data element. But that has also led to an extension of that program to make sure that where we need to be more thoughtful and more expansive in what we're covering and the use cases and the problems that we're trying to solve through data, we're doing that in conjunction with our federal partners through something called USCDI Plus. And that's going to allow us to get into more of the granular needs specific to lab interoperability, health equity and risk drivers, which is huge for the VA and really for all patient populations across the country. And there's a number of other subsets that there's lots of information on our website you can go check out. And all of this, just some real life examples of how things have played out in the course of the pandemic. We've been able to leverage the Smart Health Card standard, which many of you know and have utilized likely very often, especially when you think about having to show proof of vaccination, for example, but also with your, if you have an app that's based on whether it's an Apple or some other type of health card platform to get your records and to see that information more seamlessly. I would say it's still relatively new from kind of the bell curve of adoption in terms of how many consumers who, of course, have to have that higher technical capability in their smartphone, for example. But that has really started to promulgate, as Dr. Evans said, and be something that developers and industry providers and partners, Snowflake's a great example of where we're seeing that when we look at the standards that have already been tested and are tried and true, we can really apply them to harder problems that require pharmacy providers and other non-traditional health IT actors to leverage those standards to move large amounts of data accurately, securely, and quickly. We did that through behind the scenes standing up vaccinefinder.gov. We're doing this now through the capture of over-the-counter COVID test results. These are the things that people wouldn't know about necessarily because they're not headline news per se. And then hopefully we'll be extending some of those successes to programs with partners like NIH, ASPR, of course, with CDC, FDA, and others, just to leverage and make sure that anyone, whether it's the rise of the number of telehealth visits and how to make sure that information is captured properly, or continued and expanded interoperability of networks. And some of you might be hearing more about this and have strong opinions about it, but the Trusted Exchange Framework and Common Agreement is another success from this year in terms of the draft requirements being published and made public for all different types of developers, including core infrastructure providers and companies, to really be at the table to start to weigh in on what the security requirements are to make sure, whether it's a patient consent issue or a network security issue, that the permissions are in place and that we are being really thoughtful and thorough in what we are requiring of industry moving forward.
A lot of coordination activity there, and good catch on, look, you can secure the data, but if the quality of the data is not there, then you don't have the foundation to work off of. You referenced Snowflake. I'm going to go to you, Murali, and give us an example of a program you'd like to highlight.
Absolutely, Luca. And great points from Ryan from ONC. I want to double click on the data collaboration and the need to consolidate all of the data and eventually generate insights that will drive patient experience that came up in the discussion today. From a context of two different use cases. One is accountable care organization who are participating in CMS Medicare SAT savings program can hugely benefit from such a data collaboration and data interoperability. Participating providers in an ACO can now seamlessly come together, exchange data, and with our technology, they can bring all of them together to build a view of the patients that will help them understand the care gaps that may exist within their patient population. The ACOs can then effectively use that data or information to close the care gaps and thereby performing well in an ACO model, right? Great use case, and again, greatly ties to Ryan, what you spoke about in terms of the interoperability, how organizations are going to come together. The second use case is from a context of value-based care. If you take a look at healthcare providers, who are getting into a value-based contract with health plans, they often rely on member attribution data, claims data from health plans. The way they have traditionally gone about doing this is they'll request for a file. The plan ships a file to them through an FTP. The provider gets them, goes through a quality process check. But during the process, if you look at it, it's very time consuming. And if there are any quality issues, they have to go back and redo the whole cycle with the health plan. But with our data collaboration and data sharing technologies, they can now seamlessly come together onto our platform, exchange that data, and cut down that time to insights, right? And this will greatly help any healthcare organizations to be successful in delivering the promise of value-based care.
A very interesting concept there, and a lot of coordination behind the scenes, so to speak, to make that patient experience, if you will. Carl, I'm going to roll up to you. I know you've only been there for a short amount of time, but no question you all are involved in several different programs over there. Can you highlight one?
I'm going to cheat, Luke. I'm going to mention two. I'm going to deep dive one. So, and I think Jonathan could identify with this, that as a department CIO, you own nothing. You're responsible for everything. And that's what I'm discovering.
We got a smile out of Jonathan.
Yeah. So, but so I'll mention a couple of programs, but my job's to enable the operating divisions and staff divisions to do their job. And so you look at a couple of these things, some really exciting things going on. For example, with Vid Desai, the CIO of the Food and Drug Administration, he's working some AI projects to improve our health inspection program. Some exciting things happening there with AI and how they select what should be inspected. If you go over to Andrea Norris, National Institutes of Health, she's done some fantastic work in putting together data storage solutions amongst the cloud service providers to get better rates and come up with ways to do mass storage. We're talking 170 petabytes of research information here, and allow researchers to share. So, when you dig into what the operating divisions are doing, there's a lot of really great projects going on that have been going on for a while. But there is actually one that I own that has been going on for a while. I think is doing some great work, runs out of my shop, and that is associated with the risk management across the healthcare sector of the United States. And we don't, I know you think health IT, you may not think about this, but when we talk about critical infrastructure of the United States, a lot of people think of the energy grid. But I'm sure Ryan would agree, what we really also have to think about is that IT infrastructure that keeps our hospitals, our clinics, the pharmacies all running. And so that is one of the things I take care of through two different programs. One of them is called the Health Sector Cybersecurity Coordination Center, HC3. And what this does is it goes out and analyzes threats to the public health infrastructure and develops alerts and analysis and reports so that we can let partnering institutions know about possible issues. We also go through and look at new URLs as they're published, and if they're healthcare related, we'll look to see if they're scams or they're putting out malware. Give you an example. I've got the stats right in front of me. Last week alone, we looked at about 1,400 URLs. We sent down 162 takedown notices to the internet service providers because they were dishing out nonsense. And so we partner also with the Office of the Inspector General so that when there are data breaches, we assist with sending out victim notifications. Like last week, there were 5 of them sent out for issues that happened across the sector. Additional program we run is one that is really effective, is a government industry partnership program. It's called the 405D program. That's because of the statute. It's a section of it. but we've got over 230 industry leaders that represent over 1,000 hospitals, clinics, pharmacies, you name it, that participate in this. And we work together to develop guides, procedures, things like that to enhance the security of the healthcare infrastructure. And so the primary product, and you can go out and look at this, you can go to hc3.gov, the 405D .gov is also out there. You can look, there's a guide called the Health Industry Cybersecurity Practices Guide, which my staff affectionately pronounces HICCUP. But that guide has been cited and used all over the place. In the last 12 months on social media, we've done 450 posts to kind of broadcast the procedures and best practices, received 400,000 hits on it, 370,000 were this year alone. The program's just gained interest and is starting to roll even stronger and stronger. We're working with OMB, working with the White House on improving this cybersecurity across the healthcare sector. So I think this program is having a true, real effect on security. And I think there's a lot of exciting things that are going to continue to happen. And of course, we're partnering with ONC. So, Ryan knows all about this, but just lots of good things happening there, Luke.
Sounds like there's a lot of moving parts going on, all good. And we really do appreciate all the work. We're going to take a small break and we're going to be right back. You're listening to the Federal Executive Forum on the Federal News Network.